Hi, I'm Dr. Patti Farris, and I'm your host for this episode of Skincare Confidential. We're really excited to be coming to you live from the Science of Skin Summit 2025 in Austin, Texas. And I'm super excited to welcome my guests, the co-chairs of our esthetician track, Sarika Diaz and Renee Rouleau, the legendary co-chairs of our track.
Sweet.
It's so great. I'm so happy to have both of you. And I'm really excited to hear about what was going on in that room. There was quite a buzz.
Yeah.
You had so many estheticians there. So let's kind of start about, how did you guys get interested? First of all, I'll start with you, Sarika. How did you get interested you came to the summit the first year, didn't you?
Not the first year because it was in
Second
New York.
year, that's right.
So the first year was here in Texas because I hail from Houston. So I was an attendee. And then through the promotional emails, I saw an email for the third year. It said, we're going to have an esthetician's track. And with all due respect, my very first thought was, well, what do two dermatologists know about being an esthetician?
Nothing.
But I don't know anything about being a dermatologist. So we've both got our own lanes, right?
Of course.
So I just replied to that promotional email, just introducing myself and giving a little bit of history of my background, and asked, are you seeking speakers or faculty members for this track? Because again, there was nobody listed. It was very general.
Right.
And to my surprise, about an hour and a half, 2 hours later, I got an email from Dr. Ted. And I was like, it wasn't just like a general meeting manager. It was from the man himself. And I was like, oh my goodness. He's like, yeah, I'd love to chat with you. Let's get on a call. Can you talk tomorrow? And I'm like, yes. And then after I
Clear your schedule.
Yes,
right?
I will. Yes, whatever you need, Dr. Ted. And so I talked to him the next day. And then I think in a day or two later, I was chatting with you and we are just kind of brainstorming. And then it just kind of evolved from there. The first year I attended was, the second year I attended, but the first year as a faculty member.
Right.
And then to my lovely surprise, I was invited back last year and this year with my buddy Renee to be co-chairs. So for that, I'm eternally grateful.
Oh, that's so fantastic. So we went after you.
Yeah.
I don't even remember.
She's way popular.
They're like, if you're going to have an esthetician track, you need to know Renee Rouleau.
Yeah, I was part of the,
okay.
Don't call me, I'll call you, right? So.
So anyway, it was so great for you to, you're here in Austin, first
local.
of all, but I know you practice in LA too.
Yeah.
Tell us a little bit about your practice because it's so fascinating.
Yeah. So I have been an esthetician for 37 years. I started Renee Rouleau Skincare, my brand, 29 years ago. We just celebrated 29.
Happy birthday.
I know. Thank you. And I had two skincare spas in Dallas that I had for 22 years. So I employed estheticians at both those locations. I was a full-time practicing esthetician. I actually had my first skincare salon outside of Boston that I had with a partner where we employed estheticians, and I started that in 1991 when I was 21 years old. So 21 years old, I was managing people, didn't really know what I was doing, but you figure it out. And I remember at the time, being such a baby esthetician, and because I started when I was 19, and it's like, I had these clients that were in their 30s and 40s and 50s. And I remember I can't wait to get older because I feel like they're like, what do you know about aging?
I started at 19 too. Yes. So I very much that resonates with me.
So when I turned 30, I was like, okay, fine. I'm getting fine lines now. Now I can, they'll be like, okay, she knows what she's talking about. But, so we did, wind down our spas right before COVID in Dallas. So as of 5 years ago, now our company is based here in Austin. And, as of 5 years ago, I was no longer in that world anymore, but I'm still a practicing esthetician. I have celebrity clients out in LA, so I'm a traveling esthetician. So Sabrina Carpenter, Kiki Palmer, Demi Lovato have been my clients. So with Sabrina Carpenter, I'm on tour with her sometimes, caring for her skin. Demi Lovato just got married. So it's really fun. That I still am hands-on, but it's literally 1% of my time, and 99% is being the CEO of my company, developing new products, and just, our D2C company. But then we just expanded a year and a half ago now to have our products sold through estheticians and skincare professionals, and mainly because I missed being around my people. It was like now I was just a product company selling direct to consumer as we've done since 1999, but it's been really nice to have, estheticians and skincare professionals represent my line.
Yeah,
so I'm like back with my people again, and it feels wonderful.
Yeah,
Yeah.
that's fantastic.
Yeah.
So you guys put together a great curriculum. So maybe the highlights of, what lectures were people really clamoring at, and what was the breaking news or any interesting things that you guys even learned?
Some of the feedback that I got from some of the estheticians I kind of chit-chatted with after the session, they really enjoyed the breakout sessions that we had, mostly because our esthetician is such a community, and we're such people that love other people.
Yeah.
And so a smaller, more intimate setting and a chance to actually talk to some of the speakers and faculty and getting to pick our brains around certain topics. Some of them were like, oh my gosh, that was my favorite part.
And then hearing that, because that was new this year and we talked about it. We really wanted to bring the community.
And I think it was really successful. It resonated with our audience really well. And then I had performed a Moxie laser demo sponsored by Sciton, and some of the audience, they're not laser certified. It depends on where you practice, what the laws are in the state. Here in Texas, we have 2 separate licensures for estheticians and laser professionals, which I hold both.
Oh, interesting.
And so some of the girls who don't know much about lasers came up to me and asked me, like, that's so cool. Like, how do I learn to do that? And I'm like, well, we got to see where are you located and those things. But just for them to be able to realize that depending upon where they practice as an esthetician, they are capable under doctor delegation to provide those types of corrective services.
Oh, yeah, that's great. I love that.
Yeah. So a few things that stand out for me. One is, echoing that, we're estheticians, we're in the relationship business. We just happen to do skincare, right? So having those breakout sessions, where, you had that kind of connection time, we love that. But speaking of relationships, the Alexis Robertson did one on setting boundaries in the treatment room. And that was really well received because, again, we value relationships. Estheticians are caregivers. And a lot of times we don't do a great job at setting boundaries with our clients. Somebody shows up late, right? Sometimes we don't want to be like, hey, I have to cut your treatment short. We don't want to hurt their feelings. And so, or no shows, right? You have people that got on your schedule and they don't show up, and then enforcing cancellation policies and things like that. So that a lot of people really like that because she gave some good phrases to say, to help. Exactly.
Helpful.
And so I thought that was really good. And then ingredients, right? Estheticians love to know about ingredients. So the fact that we had 2 chemists, that spoke about ingredients, that was really, really informative. And I mean, you could, basically you could see by how many people were in the room. It was standing room only
I was standing
for one
of
them.
The cutting of the breaking kind of. All of the new ingredients.
Yeah. And Valerie George did a really great job from a cosmetic chemist perspective.
Yes.
She was really good at talking about trending ingredients.
Yes,
so PDRN and exosomes, but did a really good job at, kind of the pros and cons, but she was really objective about it.
Right.
And,
is she a chemist?
Yes.
Okay.
Formulator.
She was really very good. I was thinking she was extremely knowledgeable. She talked about probiotics.
Exactly. She's a researcher.
I love so much about the education that we provide here, because if it's not a sponsored product theater directly from a brand, all the other education that we deliver to our attendees is able to be applied across the board.
Right.
I know I've attended so many other esthetician conferences where every single talk track is sponsored by a brand and then they're only talking about their product.
Right.
But I love how we've worked so hard to try to keep so much of this information translatable into generalized practice to strengthen our skills.
Yeah.
And I know you spoke on acne treatment, which is a specialty of yours. And I'm shocked when I'm talking to the estheticians here, how much acne they're treating. Yeah. It's unbelievable. So I heard the beginning of your talk, but not all of it. But the room again was totally packed because it's such an important subject.
Yeah. Well, and as estheticians, that's really kind of our bread and butter because that just oftentimes requires our hands,
Yeah.
right? It's,
Yeah.
so especially for like solo estheticians, they don't have a medical director. They don't have
Right.
the lasers and the big fancy machines, but that's kind of how we all kind of start. And then as we grow in our career and maybe, move up and then get a medical director, and now we can do, more aggressive things. But acne is really the foundation of estheticians, both teen and adult acne as well.
Yeah.
It's that bread and butter.
Yeah.
Yeah, it is bread and butter. It's our bread and butter too, by the way.
Yeah.
Derms, it's the number one diagnosis in the derm practice.
But I mean, and here's the thing, and we're all looking for a cure, right?
Yeah.
And the reality is acne is a skin disease for which there is no cure, right? I mean, when I started 37 years ago, I was trying to help people cure their acne,
Yeah.
and today,
Here you
37 years, here I am. Like,
No
what's
progress,
changed,
that's
right?
such a
So,
cure.
and that's what I always say is like, everyone's like, oh my gosh, the skincare industry, so many advancements or whatever. But I was like,
yeah.
we're still trying to, how much advancements can there be? We're still trying to cure acne. We still haven't solved that one. And I remember probably about 10 years ago, there was supposed to be a vaccine for acne. And I wrote a blog post about this, and it was like, oh my gosh. And never
So
came
stay
to,
tuned because
Well,
it's still on the front burner right now.
I'm sure, but
So
I mean,
stay tuned.
but it's been
It's
10
gonna
years
happen.
and still hasn't come to fruition. So I'm like, there's still, and I think, I mentioned in my acne talk, which is, our skin is as unique as our fingerprint, right? And that's the challenge, is it's so specific to every, it's just not, it's not black or white,
Yeah.
I know when I'm treating patients with acne or I treat a lot of pigmentary issues being in Texas.
Oh, yes.
And I have a
course.
large patient population of skin of color. So particularly things like melasma and then PIH, that's a direct result of acne.
of course.
I tell them, look, we have to learn to manage these conditions. There's not a cure.
right.
Boy, wouldn't we be rich if there was a cure.
Exactly.
But we're having to learn to manage these things in order, and I guess that is kind of good for our business. I guess we wouldn't really have too much to be doing
Yeah.
if we had cures.
Well,
And there are-
no one's probably as close as we came. I mean, and it doesn't necessarily cure it. We do have a lot of patients who take it multiple times.
Right.
Yeah, we
Especially
work
the ones
hard
with
to
more
manage
severe.
a lot of conditions.
Yeah.
And there are a lot of tools. I mean, there really are, but I think,
lactone, I think, has really changed the.
that's changed a
whole
lot.
paradigm.
And the oral. I have so many
Right.
patients that
Oh, yeah.
one stops working or they switch over to the other, or
Right.
they do a combination of both. And
But I think it's really getting, for us as estheticians, it's really, I said in my acne talk, we are acne detectives, right?
Right.
We spend that time really understanding their life, their lifestyle, nutrition,
I was
everything.
Just
And
ask you to
it's-
talk nutrition with them. 'Cause
Yeah. I mean,
you now as
I-
dermatologists
I like
more
to-
than ever.
refer out. I mean, that's not my specialty. I understand that the importance, and we had our panel on integrative skincare.
Yes.
So talking about treating a patient as a whole, not just trying to put a Band-Aid on the surface of the skin, but okay, are there hormonal issues underlying? Are there dietary things going on? Like, how is your lifestyle? Do you smoke? Do you drink a lot of alcohol? How do you sleep at night? What are your stress levels? If your cortisol is high,
Yeah.
that acne is going to flare like you wouldn't believe.
Can't fight stress.
No,
You
and just
cannot
like you
fight
can't
what it does to
Yeah.
your skin.
work out
Yeah.
a bad diet, we can't out
Yes.
treat other poor lifestyle habits.
Yeah.
So,
Yeah.
I tend to I have a list of people that I like to refer out to. It's like, I would like you to go and let's get some better understanding around these suspicions I have. Because I'm not a doctor, I'm not going to diagnose you. But let me send you to a friend of mine who's a dermatologist or somebody who's a nutritionist. Let them run your blood panels. Let's get a see what
all
the
the
bigger
picture.
picture.
It's
Yes.
all the tools, but these are all the tools in the toolkit.
Detective work too.
Yes.
So that
when do
we
you
come together.
recommend this? When do you pull out that tool in the toolkit? I mean,
So
it's a
such
puzzle.
a multifactorial condition. There's so many things playing in, from the lifestyle issues, the hormonal issues, the stress. There's just so much that plays
Just
into
life.
it.
And
in
one
general.
of the things that, for my skincare brand, we really make a distinction between teen and adult acne, right? A teen is going to be oilier, more sebum.
Yep.
So you treat that differently.
For sure.
And then, but somebody can all of a sudden be perimenopausal and start
Get
breaking out, and you can't treat them with teen products,
No.
right? So it's all about
No.
healthy barrier, and there's different,
Consideration.
solutions that we use for adults versus teens, and that's a good distinction.
So where do you think we're going next year with the esthetician track? You two are not off the hook, by the way.
Oh,
Okay.
I didn't want to make an assumption.
You're signed up. Check.
check. Okay,
Check.
I'll be here. I'll mark it on my calendar.
It's going to be the 18th through the 20th of September. Just for
Lovely.
our listeners. Science of Skin Summit back here at the Fairmont in Austin, which we love this hotel.
It's a great venue.
Yeah, it's been great. But we need to shake it up again like we did this year. So we're going to be looking forward
and
to.
we got a lot of feedback that people. So I mean, the goal is to get better and better, right?
Sure.
But
Good, yes.
we got a lot of feedback that people just loved. All the tracks this year
And
better
then,
than last year,
if
which was
you
great.
didn't get to give us any feedback, please reach out me, Renee, or to the
Yeah.
conference itself. We'd love to hear your feedback because
Yeah.
we are estheticians for estheticians, and Renee and I have really put our heart and soul into trying to cultivate a safe space
Yeah.
for us to come together, become community, collaborate, learn from each other, lean on each other,
Yeah.
and we can only really make that better with your feedback and their
Right.
help. So
Right.
please don't hesitate to reach out. I'm very accessible through Instagram.
Yeah.
You're thinking
yeah.
pretty too?
Oh, yeah,
You
absolutely.
two are on
Tell us what
social
you
media.
want, yeah.
You're looking at your DMs.
We
and
want to hear it from the
LinkedIns.
people.
Yeah.
Yeah. That's feedback is so great. Well, I want to thank both of you for taking the time, giving
Thank
us this
you.
little recap. And I love, somebody told me about Esty Besties.
Yes.
And
Well,
it's so cute. I mean,
Yep.
I almost cry every time I talk about the esthetician track.
Yeah.
Because it's so wonderful, your community that you're building there. And everybody's so happy to be here. And they're in those sessions with the dermatologists and all of the other doctors. And we really love mixing it up. So again, thank you guys for all your
I mean, at the end of the
efforts.
day, we all are serving our clients and patients.
Absolutely.
We want them to become more confident in their skin. We do it two different ways.
Yeah.
And
but we're allies.
Right. We work together synergistically.
I
and-
love the
and it-
panel this year on the esthetician physician relationship,
Yes.
which Renee sat in on. And
Yeah.
Thank
so
you
great.
to you and Dr. Ted for recognizing that we are allies. It's unfortunate that there are so many doctors out there that
Ugh.
don't recognize that.
Yeah.
And
or
our
they
goals
just-
at the end of the day
they're
are the
just
same.
not educated. They don't know
Yeah.
the role that we
I don't
play.
even think they know what you do.
That's
to
what
be
I mean.
totally honest.
Right. Exactly.
It's just lack of knowledge.
And there
I
are different
think.
types of estheticians, more medically trained like myself.
Right.
More traditional, like Renee works exclusively with her hands. There are some holistic estheticians, and we all have a place in this
Everybody,
space.
everybody has a place. And as you said, we're all trying to just take care of people and make them better, make them more confident.
Our goals are the same when you boil it down.
Yeah,
So
absolutely.
thank you for
You're welcome.
having us.
Thank you both for your efforts. We look forward to 2026 here in Austin, September 18th through the 20th at the Fairmont Hotel. For those of you who are listening, if you like this, we'd love it if you would subscribe and also give us a 5-star review. And thanks for listening. We'll see you next time.